Hi, Dr. Shauna Rupo, Girl Next Door OBGYN. I saw a patient today for endometrial uterine polyp. She was a follow-up from the emergency department, and it just got me thinking that this is a pretty common concern that I will see patients for, and they often have a lot of misconceptions when they come to see me. So we tend to see polyps in women who have elevated BMI. That's a little bit more common because estrogen levels are higher. Women who have PCOS or who have ovulatory dysfunction, just because they don't have a regular cycle that allows them to have this coordinated growth of the lining of the uterus and then shedding of the lining of the uterus. They can be problematic for a couple different reasons. Usually if patients are seeking fertility, so if a patient is seeing me because they're having a difficult time getting pregnant, we generally recommend to remove them. They tend to increase inflammation, make it more difficult for implantation to occur. We also will see them in women who have recurrent losses, and it seems to be that because they increase this inflammatory environment, we tend to see more miscarriages with them. So usually if you're coming to see me for any fertility type evaluation, I'm going to recommend that we remove the polyp. Most of the time it starts where you get an ultrasound, just a regular ultrasound, and we suspect a polyp on the imaging. The reason for that, I can't be 100% sure, is because I can't directly see it. So there are things we can do to follow up with this information to be sure. So usually the next step is going to be to do a saline infusion sonohistogram, which is a specialized ultrasound that I can really see that lining, that contour of the uterus a lot better. And then that will help us decide, is there in fact a polyp there, and do we need to go forward and remove the polyp? Those are usually removed in the operating room. We can do this also in the office. We have in-office procedures where we have anesthesia come and you could have the procedure done under sedation. But generally we put a camera in, I'm gonna identify the polyp, remove it with little scissors or a little scraper, little instruments, little graspers. And then once that polyp's removed, that helps to kind of restore the normal functioning of the lining of the uterus, the endometrium, so that the inflammatory markers aren't there and you don't have this increased risk of infertility and increased risk of pregnancy loss. So they don't always have to be treated. I would say in fertility type patients, we usually are going to recommend that they're treated. In women who are not trying to get pregnant, the most common thing that we'll see is that they can cause spotting, bleeding when you're not supposed to be bleeding. So in a typical menstrual cycle, you should have very predictable times where the lining is growing, you're not having any bleeding, and then if fertility or implantation doesn't occur, fertilization doesn't occur, you have a withdrawal, that shedding of that lining of that uterus. A polyp tends to not respond to the signaling from the ovaries the way that the rest of the lining of the uterus does. And so that polyp is going to create spotting and really be a nuisance, more of an annoyance. So it's not necessarily very problematic, meaning it doesn't generally lead to something kind of scary. They generally are more of just a nuisance. And in those cases, they also can be indicated that we would remove them surgically. So just thought that this would be kind of helpful. As I was talking to the patient today, I realized that this is something that commonly comes up, and it might be nice to share with everybody here. If you happen to have a polyp or know somebody that does, maybe this can ease your mind a little bit. Hopefully everybody has a great night. Bye.